Adult and Education Committee. I would like to welcome you to tonight's meeting, which councillors are required to attend in person. We'll be using the equipment connecting the chamber into a Microsoft Teams meeting, and some of the officers involved this evening will be joining remotely via Teams. I need to inform everyone present that this meeting will be recorded and broadcast live on the internet through Teams, and the recording of the meeting will then be uploaded and available for repeat viewing on the councillor's website. So without any further ado, I just wanted to say this has been a week for social work week. And I want to say to our hardworking social workers out there, thank you for all the work that we do, and the councillors also to join me to thank them for all the hard work that they are doing. Thank you so much. And also it's Women's Month, so celebrations going around in our town and everywhere in the country. Thank you to everybody who does a lot of work as a woman out there. Thank you. So to start off, any declaration of interest? Anybody? No? Okay, thank you. Anything on the minutes? We're checking on the minutes, please. These are the minutes for the 18th of January. No, thank you. Agreed. Thank you. There's no petitions and there's no questions today. Thank you. And there's no questions also from members of the public or any councillors. So on the decision book reference, there's nothing. Yep. And we go first to our updates, which is the RBH Building Berkshire Together update, which this one is coming from Alison Foster, Program Director, Building Berkshire Together on the redevelopment of Royal Berkshire Hospital. And she will be joining on Teams. Is she there? Oh, she isn't there. Okay. Okay. All right, we can go to point 7 because I think there's some Alison Foster isn't online yet. So we can see Alice is there online, so we can go straight to Alice for Health Watch Reading. She's the lead for the Health Watch Reading. She's going to present to us the Health Watch Reading update of some of us have received a link. Thank you, Alice, for coming. Can you hear us? Are you okay? You're muted.
Sorry, Chair, that was Alison Foster ringing me saying that she's stuck. She's trying to dial in. My apologies.
Oh, that's all right. I think you can go ahead. When she comes in, we'll go to her just
Okay.
to give you that space. You can go ahead with your report. Thanks.
Thank you. Thank you. Good evening, everyone. My name is Alice Kunyipi Clifton. I think some of you have met me before. I'm the lead officer for Health Watch Reading. As you all know, that Health Watch has been here for the last 10 years. However, as in June last year, the new team took over. So we are at the moment hosted by the advocacy people. So I am part of that team. But Health Watch, one of the reasons for me to come and introduce ourselves is because there have been rumors going around that there's no Health Watch is no more. Well, the thing is, HealthWatch is a statutory service under the Health and Social Care Act of 2012. HealthWatch must be commissioned in each area, so we will never go away unless legislation says so. But the reason for also sharing with you all is to say to you all, our purpose is to encourage people to have their say about the way services are planned and provided. And we are independent, gathering feedback from the people about their local health and social care. I have shared with you all the work plan, so I'm not going to be talking a lot about it. So there are things in the work plan that you might have seen or might not have seen that I'm quite interested to know from you all. If there's any discussions that you would like. So we provide information about available local health and social care services to help people make informed choice. We also have we review how services planners involve patients and public in their decision making and hold service planners to account. With other 152 other health watches, we provide feedback to help Health Watch England get a network picture. So that's what we tend to do. So what we want to do is hear from the public about their experience of health and social care. Is it through complaints, concerns, and compliments, good or bad? We all are welcome. So the ask is for me to come to you all is I need your help to get to the public to come and talk to us about their experience of health and social care. As you're aware, our remit is quite large and quite wide. So we are from cradle to end of life. That is what our remit with health and social care. So we don't really, we can't do everything, but there are specific things that we do. We have 2 statutory powers, whereby when we write to service providers, they have to respond within 20 days. The other one is we have, as a local health watch, we have a statutory power to enter and view any health and social care providers who receive funding from the public purse. So that's what we do. We work with the CQC, so we are part of the Care Quality Commission and work closely with them. So enter and view is not an official inspection. However, we have a duty to share with the Care Quality Commission any concerns. The other thing is also part of so since we came on board and our remit is very large, what we have done is we've shared with you our current work plan. So what we are doing is recruiting volunteers and staff. So just to share with you, today, I have a full quota of my staff now, which are diverse team. So, which is I'm excited about. What we've done is also we've been doing a survey on maternal mental health, and the survey has come out showing that GPs are not doing their 6 weeks postnatal check, and mental health is not a priority. It's only a tick box activity. While we came on board, we've had feedback about the asylum seekers who are in the contracted hotels. So when we got to know about that, we have been advocating for them in such a way that we've been going to council, especially Reading Borough Council, to turn around and say what are the concerns that we have shared. Equally, we've also gone to the Integrated Care Board and shared with them the concerns we've had about the experiences this vulnerable group have been having. So to share with you today, the safeguarding team of the Integrated Care Board will be doing an assurance visit soon to ensure that this group of people are not being being looked after. And the other thing that we've been doing is, I mean, Alison was supposed to be here, but we've been supporting her team to get public consultation on the future of the Royal Berkshire Hospital. What we're also doing is also reviewing the previous Health Watch's work. So one of the things that we would like to come to the table soon is also looking at the information standard, accessibility information standards, such as interpreters, which is needed as a statutory requirement. We also have a watch list, which is we're looking at what work we are planning to do. So we are still looking at access of GP lead services. What is it? We're also looking at access to NHS dentistry. We now also added on pharmacies, because there are some pharmacies that are closing as well. So that's also on part of our list. We're also looking at quality and inequality in maternity services, especially with ethnic minority groups. The other thing that we on our watch list is cost of living, continuing healthcare funding and support for carers, and also mental health for young people. I mean, as I said, these are specific. We are watching to see the more feedback we get from the public about the concerns. That's how we do our work plan. And, you know, if there are any questions, happy to answer.
Oh, thank you very much, Alice. Thank you for that. Any questions from the councillors? Councillor McQueen.
Thank you, Chair. Thank you, Alice. Thanks for that presentation, well, the update there. It's really useful to know, and we're very pleased that you're still going, so that's really important. You've actually, some of the questions I was going to ask, you've covered, but I was just going to ask about the feedback, because sometimes people, you know, when people complete surveys and ask, you know, give feedback, so more of an explanation about where that actually goes and how you use that data. But there's another couple of questions, if you don't mind. How do you find the different groups that you work with? And I was wondering about different settings that you could go to, you know, for example, like extra care schemes to work with different residents, and how do you sort of work with those groups? And what else was going to ask? Okay, some of the things you did actually raise, because I was going to ask you about the asylum seekers. So obviously it's such an important issue here in Reading, and I wonder if it'd be possible for you to come back at some point and talk to us about the work that's happened there. I think that would be really beneficial for board members. And also you mentioned dentistry. Sorry, I know I'm going through lots of things, but there's a lot of information in the report. But I think the dentistry is a huge issue, especially in Reading, because you'd be aware that many of our residents can't access dentists, and we talk about dental deserts at the moment, don't we, where it's so difficult for people to be able to actually get a dentist appointment, never mind an NHS dentist appointment. And finally, I was just going to say, how can we as a board sort of help you, you know, as a committee, how can we sort of help you going forward?
Thank you, Councillor. Oh gosh, echo. I mean, the thing is, though, as a new team, we are out and about already, kind of thing. We've been going out to events. So we've been so what we've been identifying is the deprived areas. So we've been trying to get feedback from them about what are the concerns have been. So we've been highlighting those areas. So Whitley has been one of our areas that we've highlighted. So we've also gone to Caversham. So I mean, being out and about has been our big thing, because I think that's how we get our feedback. And also what we also do is, on top of getting the feedback, we go back with an answer too, because one of the things that, you know, you said we did, I think that's the way to get trust from the people that we deal with. So that's what we've been doing as well. So, you know, and one of the thing that I have done in our team, has made our team very diverse so that they can go out into the communities as well. So just to share with you, at the moment I have got one of my team is from Ireland, one of them from Sudan, one's from Nigeria, and one's from Bangladesh, and including me as an ethnic minority. So they see, and then I also have Andy, who's an English person. So they see the diversity. I think that's the only way that we can get out there and show them that we they matter. And that's what we've been doing. And then one of the things that has happened, highlighting that asylum seekers has been one of the ways that we've got a lot of feedback. We've been also working with Alliance for Cohesion and Racial Equality with their community champions as well. So and getting feedback that way. So that's what we've been doing. So the ask is, please share with people as much as possible what Health Watch is, because I think people don't know what Health Watch is, and how we can have, because our statutory powers, we can move a lot of things forward. So I think that's what it is. I think more visibility of Health Watch is what is the ask from me to you guys. Is my request.
Thank you very much, Alice. Any questions from councillors? Councillor Ennis?
It's not really a question, really. It's to welcome you, Alice.
Thank you.
I mean, I don't know where the bit about Health Watch has gone away, because it was a new contract. It's a new beginning. It's a year old now. I'm not sure where that's come from, but there you go. And that's really good to see you. And your role is so important, holding us to account in adult social care as the lead counsellor for adult social care. It's so important that you do that, but we also want to work with you to hold health to account as well, and to make sure you represent the people of Reading. That would be discharges. It would be with making sure that the hospital pack coming out, and the packages are fit, and the care homes, and also the care packages, the contracts are fit for purpose for our residents. So you've got a massive role that we need to support you in. I think it's good when we get held to account by Health Watch. So it's really good to see you as a regular fixture with reports. Also coming to the older people's working group. I know there was mention about you going to that, wasn't there, Alice? Going to the older people's working group and meeting with residents and discussing their concerns. GP surgeries, it's never ending, and it's such an important. You are so important to the running. You can be the social conscience. That's what I found Health Watch to be, the social conscience for the people of Reading as far as health's concerned. So really welcome tonight. Saw the work plan, definitely agree and welcome with the objectives. Look forward to being held to account as adult social care, but also working with you as far as health is concerned as well. So thanks a lot for coming tonight, Alison. Look forward to working with you more and more.
Thank you, Councillor. Thank you. I mean, I'm all about collaboration, and this is about the public. So that's very important. So, we'll all have got the same agenda.
Thank you, Alice. Melissa, you wanted to add something into this? Yeah.
Thank you, Chair. Nice to see you, Alice. I just wanted to really echo Councillor Ennis's point. I think as the new provider, you've really hit the ground running. And I think if there is a concern about Health Watch going away, I think you're very quickly putting that to bed in terms of the myth. I think you've raised some really important things that across the system we're all very concerned about. And I think we do need to take a system approach to things like dentistry and the immigration hotels, etc. So I think I really value your input and coordination in that, and really holding up that mirror to challenge us all as partners to say we need to play a role in this. I just had a small technical point really to ask. You've talked about you want to facilitate people having a voice. I wanted just to better understand, where are you visible, Alice? You know, where are you advertising about, you know, come to Health Watch? And where best do we signpost people to, members of the public? Is it you know, your website? I just wanted to better understand that. Thank you.
Thank you. Well, we have got a new website, so people can reach out to us that way, but we are out and about. So we are going to put out leaflets into the surgeries, into any care homes. So wherever we are, we will put out leaflets for them. And I will, if you allow me, I would happily put it in the council chamber as well. So if that's possible, but you know, but just ask the question and we will give you the answers. But yeah.
Thank you, Alice. Councillor Gavin.
Thank you, Chair, and thank you for the report. I'm currently the chair of Access and Disability Forum, and I think that it would be a great opportunity for you to reach that particular group of people and the organisations who support them in Reading, who tend to come along to the working group. So look out for an invitation in the near future to come and talk to the Access and Disabilities Working Group. Thank you.
Thank you.
Thank you. Thank you so much. Any other question for Alice? Thank you so much, Alice, for coming, and I'm looking forward to seeing tomorrow for the inequalities in maternity. Thank you very much for coming.
Bye-bye.
Bye. Okay, Alison is there now, so we move back to point 6, where Alison Foster, Program Director, Building Berkshire Together on the redevelopment of Royal Berkshire Hospital, will give us an update about Royal Berkshire Hospital. Thank you for coming, Alison.
Oh, thank you, and I'm really sorry I'm late coming. We had a visit from the new hospital programme team actually today, and they were a bit delayed. So, and I've had to come to London for an all-day event tomorrow with the new hospital programme, as things are starting to ramp up a little bit. So, if I just, for people who haven't had the presentation, I'll just spend a few minutes just putting into context where we are in the programme. I think I can share, can't I? Let me try that. You see that?
Yes.
Okay, so, oh, I can hear myself. Can you, is it all right? Okay. So, yeah, the Royal Berks was put on the new hospital programme back in 2019 now, and we are in cohort 4. Now, that means that it's technically we're called full adopters of the new model or new ways of building a hospital, which means that if there's 40 new hospitals being built and in a similar time period, it would make sense if we all collaborated and developed standardized approaches or standardized models in some respects, because we all have the same policy to abide by and guidance to follow. So we could make efficiencies in standardizing a lot of what we do. Also, if we're all going out trying to buy stuff for the hospital at the same time and get it built at the same time, we'll jam the market, drive up prices, and have real issues with supply. So a program of that size and magnitude needs to be pulled together. The idea is to deliver efficiencies in the time it takes to build a hospital and in the cost for building a hospital. So if, for example, we're using standardized room designs and ward designs, then we won't have 30 or 40 hospitals paying designers to design bespoke rooms for us, as an example. So we've been waiting for quite a while to understand what our allocation means and what that means for the Royal Berks. We submitted a strategic case back in 2020, which is part of the business case process for Treasury to actually get the funding allocation, and that set out 3 preferred options that would meet our criteria. 2 were linked to building on the site, and 1 was a brand new hospital on a new site. over the last couple of years, the programme, the national programme, have been developing this new model and this new approach. I was hoping to have some amazing news for you guys today around funding, because we have been told in the last couple of weeks that the Treasury, the Secretary of State for Health, and the Number 10 have reached an agreement on funding for the whole hospital, and it's just awaiting an announcement now. It's being scheduled. So again, that was reinforced today by a visit from the national team, and the senior responsible officer for the programme attended and updated us on. Couldn't give us many details. We have to wait for the announcement, but feels that the news will be very positive for Reading. And what does that agreement mean? What was described was a support for the hospital to what they're calling Hospital 2.0 model, which is what I'm coming to hear more about tomorrow in London. But this, what does that look and feel like? How long will it take to build? What would our local scheme start to feel like? So I guess, you know, it's kind of giving some indication that there's been progress, there has been a decision, but we are waiting on an announcement in the next, well, we've been told shortly. I expect it is before, we were hoping it would be before today, because we thought perhaps PERDA would kick in. But that, I think, applies to local policy announcements. So I think we're looking at any time in the next 2 weeks for that announcement. So I'm just gonna pause there. I think a lot will know that we've been doing quite a lot of work on in the last 2 years on developing our business case in terms of options that could be on site and could be off site, ready for taking to the next stage of the business case. Doing loads of comms and engagement. We had a great event in Reading actually a couple of weeks ago, where almost 80 people turned up from Reading at the town hall to help us with the shortlisting process. And of course, we've been doing a lot of work on our green plan. So I'm just going to pause there just to see if there's any questions around that update so far, which is an update, but not really an update.
Thank you, Alison. Any questions from the councillors? Oh, okay. All right. I think you can go ahead. You can go ahead at the moment. There isn't any question, so you can continue.
Okay.
Yeah.
So yes. So what I mean, I guess for Reading in particular, the question will be, what does a Hospital 2.0 look like for Reading, and could we build it on the site that we've got at the moment? So what they also told us was it's less about refurbing hospitals, and there's reasons for that. So if they are going to say that a hospital has certain standards in terms of single room occupancy, for example, you know, all hospitals will have to have single rooms. There'll be standards in relation to ventilation and space. It is likely that refurbing somewhere would cost a lot more than if we were to build it using modern methods of construction and bringing it onto a site, for example. So they are looking at very standardized approaches using modern methods of construction and bringing it on site in most cases. And so I guess what we would need to be doing once we understand what that means for Reading is, you know, what can we do on site? Can we do Hospital 2.0 on our current site, or will having to do Hospital 2.0 mean that we might need to look at a different alternative site? But I think it's just to reinforce that the news feels like it's positive, because we were put on the programme with what we know was a nominal allocation, which was quite low compared to other hospitals, but we have been told today that they are not going by any previous allocations, and that the news is positive for Reading.
Thank you very much. Any questions? Councillor Hoskin.
Yeah, thank you, Chair. Obviously, we wait with bated breath. I think the PERDA issue is quite an interesting one because PERDA does apply to the NHS, but whether it applies to distant government ministers and that is a slight moot point. But obviously, we'd be very keen and excited by a large allocation. I suppose I've got two questions. One you may be able to answer and one maybe not. So the first one is relatively simple. In terms of looking at the case, and I'm slightly concerned, more centrally driven business case, I suppose we'll have to wait to see the devil in the detail about how this sort of more centralised approach works. One of the things that's concerned me previously is in terms of the carbon impact of the new hospital, and obviously lots of commitments around having the most carbon neutral hospital possible. I mean, I don't know whether that will still apply to modern methods of construction, which obviously has previously had quite bad rap in terms of prefabricated buildings. I'm sure this will not be like that, and this will be a much more successful approach. Obviously, wait to see what that actually looks like. But one, will that still be part of the approach in terms of carbon neutrality? And the second one is, this is really important to us here in Reading, because you know that we've got concerns around the accessibility of a hospital if it was taken away from sort of Reading urban area, which is very central to the geographic area that it serves. And some proposals elsewhere for more car-driven site in an area that doesn't have public transport. So would the impact of people travelling backwards and forwards to the site, in other words, being less able to use public transport, would that be worked into the business case in terms of carbon impact? Thank you.
Yes, I think they're both quite closely connected. So the business case, absolutely, the aim is to try and build carbon neutral hospitals, and a lot has to be considered when doing that. It's weighing it up against the alternatives. So it was interesting. I was at an event yesterday, who, quite rightly, people were saying, you should be not building on a greenfield site, for example, because if we keep doing that, and all the damage that it does to climate. But if we were to fix what we have, we will have to weigh up the impact of that. So, for example, demolishing old buildings or bringing them back into use, all of those has to be weighed up in terms of not just the net zero impact, but also the cost and the return on investment, so how long it will last. So the idea of building a brand new hospital, and I think modern methods of construction are, when I say that, I don't mean prefab. I think we just mean that it's built somewhere else and this and brought on site. They're built to last for 50, 60 years, those buildings. So it's looking at that as well. So it's looking at how long a building would be in use. So there's a whole load of factors that would have to go into a business case that says, right, the right decision. And net zero is very strong in the criteria of the business case process. So it is weighted quite heavily. And actually, in terms of the Treasury Green Book process, that was updated a couple of years ago to reflect an increased weighting on net zero in the business case. So we do have to pay quite a lot of attention to that. I guess we won't know until we know exactly what Hospital 2.0 is and what our options are in terms of, because some hospitals, they may well have land they can just build on, that they're sitting on, but we're quite landlocked and we don't have those options where we are. So it's quite difficult. If we were to try and create space, we'd have to demolish probably to be able to build brand new on the site. So there's a lot to weigh up, I think, but it's definitely central to that. I know, and we have started conversations and a partnership with the University of Reading School of the Built Environment to help not only us solve some of these problems, but we may be able to link them up when the new hospital programme is thinking about standardisation and thinking about building on best practice, actually using the University of Reading expertise, world expertise in this area to help with that. Because we all have that problem to solve, actually. So what was your second question? It was linked around net zero.
So yeah, I think you've clarified it. So I suppose one of my concerns is, and I know previously this wasn't the case, that the carbon impact of patients, visitors, and staff travelling backwards and forwards to the hospital would be factored into the overall carbon impact of the business case.
Yes, it is factored into it, and it is part of what we have to report on and try and reduce also currently. So it's in scope 3, travel and transport. We have less ability to impact on that, but travel and transport, it's no matter where you go, what event I've been to, it is the top issue for people who want to access services. So it is central to any criteria that we have about where it's located. It has to be accessible to the people who need to access it. So it's a huge issue. It's a priority.
Thank you.
Thank you, Alison. Councillor McLean.
Thank you, Chair. Thank you very much for that update, Alison. Some of the things I was going to ask, you've actually covered, because I was going to ask about the transport. So thank you for that update. I just want to say that I attended the hospital for the look around, for the tour with Councillor Robinson. He's not here this evening, but it was really helpful. So thank you for arranging that for us, because it was really helpful to actually look around and see the work that is obviously needed within the building. I was really struck by ICU and how cramped that is, and the lack of space for storage and how difficult that obviously is for staff and the access to A&E. So I think we're all obviously aware how important the work is, the upgrade or whatever is needed anyway. Transport you've covered. I think for our residents in Reading, it's so important for them to be able to access the hospital. So, but you've obviously covered that. I was just going to ask you if you can expand on the build, because obviously if we're going to have possibly 40 hospitals, we're told, so how will that work in terms of labour and within Reading, we'd like to see local people being given apprenticeships or opportunities to work on any building works. So how will that work in terms of there'll be so many hospitals and staff required at the same time, and so the effects on the labour market?
That's a good question. It's so part of the new hospital program's approach around bringing this centrally is to try and manage that market and that supply. And we have been linking with them, as have others, around the social value that this should bring and the economic development to the local area. And that actually, if you've got a lead time of 4, 5, 6 years before you start construction, what are the things or investment that we could bring or could do into the local area to start growing some of those skills that we need? And I know that the organisations that are part of, because they've been engaging suppliers in the new hospital programme for the last year or so, as part of being on a framework, they have to demonstrate that they are able to invest in local areas where they are working. So I think this part of that criteria is there, but I do think I think you're right to raise it, because as soon as we know what the allocation is and when we're likely to go, we should be having those discussions to make sure that those things are lined up. So it's never too early to start those. But I think we've got a lead time to help support that. We probably we know that cohort 4, which is what we are not going to be in construction until at least 2025-26, and then we don't know when we're scheduled, but that's when we can't even start sort of spade in the ground, 2025-26. So we know we'll have time to look at those workforce issues. We at the hospital anyway are looking at wider workforce issues all the time in terms of the clinical and other workforce needed. But yeah, it's a very good question, and something we should be constantly reminding the new hospital program team to try and ensure that it's built in, because a centralised program could get swallowed up. But that's what we're here to do, is to remind them of some of the local issues and local needs that we have as a result of this.
Councillor Ennis.
Yeah, thank you. It's not really any questions, to be honest with you. It's thanks, Alison, for. I mean, it's the second time because you had the health and well-being given a, you know, best wishes to you in getting a good result. I know you're working hard for it. You know, I don't want to be cynical because it's a massive project and it's too important for political bantering. But the cynic can't help to say that, you know, Boris Johnson, the previous Prime Minister who promised 40 new hospitals, never intended to mislead the House when he mentioned that promise. You know, never over-promise, under-deliver. But it is too important. Having said that, I can't help myself, can I? What we you know that. What we really need is locally accessible. You know, I'm a NIMBY from Reading. Locally accessible for residents, acknowledging the massive catchment area it's got. We have to accept that and acknowledge it. But, you know, some of the feedback you've got there about making access easy for patients who don't drive, you know, really do want the hospital to be in the borough area, really, or as close as possible, so there's easy access by bus, possible by rail, because we've got some new stations coming. You know, certainly to drive there would be taking out the most vulnerable in Reading, you know, who need that hospital more than most. So I know you know that, and it's good that the feedback is pretty helpful. But as I said, I'm a NIMBY. I want it in our area. You know, I've heard rumours about other parts and thought maybe not, but let's see, let's wait. And if it comes, it's going to be very much welcomed by the people of Reading and the Berkshire catchment area. So thanks for all you're doing, Alison.
Okay, you're welcome. The just a quick point on that, because we have had to look at other sites and do some site searching, and it's I was quite surprised actually at how limited in terms of land. So if for example we you know for any reason we couldn't build where we currently are, that we're quite limited in terms of land in Reading, and that's no surprise because we're a densely populated area. So it's quite a struggle to actually meet some of that. We have got I did share in a different session. We are looking at sites on the Thames Valley Science Park, but also the Thames Valley Business Park, which is only just down the road from the hospital. But the you know, you have to go quite a bit out to get anything else that's even near the hospital. So it's a challenge. But actually, if we had to ramp up that, then maybe with the efforts of the council and people in the know, there might be land out there that we're not aware of. But yeah, it's just to note, we've been looking, and it's definitely not easy to find land near the hospital at the moment.
Thank you, Alison. I just wanted also to ask something. Most of these business plans are actually factoring technology into all these other things, and I just wanted to ask the question about, as you know, there are also in Reading people who are not digitally aware, and probably because of their incomes or any other thing. How are you getting your feedback, or how are you factoring in your business plan about that the NHS is tending more to digitalization, and there are people who actually are not able to do those things? Thank you.
Yeah, it's a good point. It came up today as well, because the Hospital 2.0 is described as fully digitally enabled. So it will have quite a lot of digital infrastructure in it. And when it was first opened, the chief exec, the senior responsible officer for the programme today, was chief executive in a London hospital, said that when they did that in where she worked, she was surprised at how many people, you know, how many people were okay with the digital digital support. So I think sometimes there's two aspects to this. Sometimes there is, we underestimate what people can do, because actually navigating around a hospital, people say, well, I navigate around the supermarket, I navigate around, you know, the GP practices, I do all of these other things. Why wouldn't I be able to do some of that here if you've got the right kit and you can help me to do that? But on the other hand, it's accessing people who don't even come to the hospital, who probably need it and who don't use that digital in terms of communication. So we've been working with Alice, actually, who's she's not here now, but we've been certainly working with Alice in Health Watch, and talking to people down at, for example, Acre and Whitley with the Meet Pete team, to look at actually gathering some evidence about what will work in terms of engagement, so that we get that feedback from groups who don't use digital, who don't fill out a survey online, for example. We can't rely on that. We can't rely on them seeing something online in terms of an event to come to. We've got to go where those people are, and we need to ask community leaders, like yourselves actually, where they are, and ask if we could be invited in to try and hear their views, and that will be part of the business case. Again, that came up today, that equality and equity in the business case is I think it's a high priority. So we talked quite a lot about that and how they're going to assess that in different areas. So it'll definitely be factored in and monitored.
Thank you very much. Any other questions? No. Okay. Thanks very much, Alison. See you next time when you come for an update. Thanks very much.
Okay, thank you. Bye-bye.
Bye.
Bye. Thank you, everyone.
Okay, so we move to the next part of the agenda, which is the childcare sufficient assessment, a report providing information on the 2022 to 23 childcare sufficient assessment, which is coming from Graham. Thank you.
Thank you, Chair. So this, you've got the papers in front of you. This is introducing the Reading's Childcare Sufficiency Assessment. Closer. Is that better? So this paper introduces the Childcare Sufficiency Assessment. It's an annual report, so you'll have probably seen this in previous years. It reflects the legal duty that's placed on Reading to ensure there is sufficient childcare in the local authority, and it places a duty on us to shape and support the sector in providing sufficient childcare for the families of Reading. I'm not planning on saying much more about it, because I think the detail is in the report, unless you want me to do more of an introduction.
It would be nice just to do a short introduction. Yeah, thank you.
That's fine. Okay, so I think in terms of the report, the headlines are that firstly, it's reassuring that there are sufficient childcare places in Reading for the children, for the families who want them. And in many respects, that bucks the national trend, where we've seen that there are increasing pressures within the early years sector for childcare places. So that's a very positive thing for Reading. What in some ways trumps the sufficiency of those childcare places is what appears to be an emerging staffing issue within the sector, and this is affected by a range of different issues, but their providers are reporting that they're experiencing staffing shortages. They're having difficulties recruiting staff into their nurseries, and if anything is to limit the availability of places, it will be being able to access the right number of staff to run those nurseries safely. You'll have seen, and I'll head the questions off. I'll try and head the questions off in advance. You'll have seen the recent government announcements around the expansion of early years places. At this stage, whilst government talks about investing over an additional £204 million into the sector, at this stage, we're not in a position where we can really comment on what the effect of that will be within the sector. We haven't seen the detail yet, and the devil will be in the detail. What you'll see from providers is that some of them will be saying that actually this could have even a worse effect on us. Some of us could be going out of business, and that's because of the rates that the free childcare places are paying through the government finances versus what they're having to pay their staff to run those establishments. So you've seen quite a lot of that in the press. We recognise that locally, but we don't yet know the answer as to whether the increased funding will begin to address that. I think that's probably most that I would say by way of introduction. The final bit, I think, is to say that whilst the survey results do indicate that most families find the childcare that they want in the area that they want, it's not always the case that they can get it locally. So sometimes families are having to travel a bit further than they had hoped. But generally speaking, the position is positive. That's it.
Thank you, Councillor Hoskin.
Thank you, Chair. Right, yeah, so I mean, on the face of it, and this is a reassuring report in terms of the sufficiency of provision. I mean, I think, as you would expect, you know, there's some stronger areas and some slightly weaker areas in terms of provision. It's also good to see new providers looking to come on the market locally. That's all well and good, but I think it's really important that we are not complacent. I think there's I think the situation is really delicate. I mean, actually, across the country as a whole, pardon me, across the country as a whole, provision of childcare is very fraught. I think absolutely it's the case in Reading as an area of high cost that one of the key risks, I think, to our the market here is staffing. I mean, we see it across public services, we see it across well, across the economy, and particularly here in Reading, that there's just not enough people to do the work. And I think there's a real concern in terms of providers being able to get the staffing. So it is, I've lost my place in here, that is actually referenced in terms of one of the sort of areas of priority. And what I've been speaking to officers and people within Brighter Futures, I think this actually is going to have to become one of the areas of concerns and priorities for us looking forward in terms of what we can do to continue to support the market. The actions are highlighted here. I think there's some good stuff around re-encouraging childminders to come back in. I mean, it might be small numbers, but I think that's really important. And actually encouraging, childcare and early years child provision and careers within that as something that we encourage and support people to be coming through. And we've got connections across education in terms of the council, in terms of what we do to do that. But I think it's really important that we're not complacent and we work hard on those priority areas. I think it's also, I mean, Graham is absolutely right in terms of, the devil is in the detail in terms of the government's announcements, but I think it's really concerning how some of it's really started to fall apart already. And I think hopefully there'll be some changes, because in terms of the announcements in the budget, any new funding towards childcare is, on the face of it, is welcome, and certainly it becoming a higher political priority is absolutely welcome. But there's a real danger that it could do more damage than it's worth. So we've already seen in Reading that staffing is fundamentally and absolutely one of the real limiters to the provision of childcare. The other thing is, I don't know who designed it, but they appear not to really understand how the childcare economy, the early years childcare economy it actually works, because at the moment the funding for the funded places is not enough. So in effect, what private providers are doing is using the charges for the earlier provision that parents are paying in order to cross-subsidise the free funded places. So their proposal to expand out that funded provision could actually place, I think what Graham was alluding to, could actually lead to provision going under and a reduced level of provision. So hopefully the government's plans, which I think are really poorly thought through, will be reconsidered. And as we're saying, we need to see how they develop. There's also, and I think this is actually really important, it hasn't even been highlighted within the media, there's a real built-in inequality within the proposals, whereby parents in work get a higher level of childcare hours than those out of work. Now, we know that good early years childcare provision is really beneficial to children and their development and their preparedness for school and all the rest of it. So in effect, those proposals will build in a further inequality for those parents that for whatever reason are not able to work. It could be long-term health conditions, it could be other care and responsibilities or whatever, and that's really unfair to those children who will have that inbuilt problem. So in terms of Reading, where we're trying to address inequalities that we see, this will be something that will place, will be a driver in the opposite direction. So that's problematic as well. So I think, look, I mean, in terms of this report, this is good that we're in a better position than a lot of places are. But I think it's a really challenging future for childcare. We've got a lot of stuff to work through, and I think it's a priority for us. I mean, that said, I think I don't know if we said it. We're not the providers, we're not the regulators, but it is really important to us as a council and as Brighter Futures that this exists, and obviously for families and children. So an area to support and nurture, absolutely. Thank you.
Thank you, Councillor O'Connor.
Thank you. First off, I really wanted to say what a well presented and easily accessible report this was. Very easy to sort of dig down into details. You have headed off some of my questions at the pass. And Councillor Hoskins has brought up the issue of staffing, and that is clearly a concern. Just to add to that, then it really is anecdotally working, in a local secondary school. I know that often young people are quite enthusiastic about working in the childcare sector. So there's obviously a mismatch somewhere from that enthusiasm while they're still in school to actually becoming, childcare workers out there. And I don't know if there's something we can do to kind of keep that enthusiasm and not have them sort of going off into different professions. But I recognise this might not be the place to sort of talk about that. Absolutely stunned at the low level of funding, that the free entitlement is £5 and sixpence. I mean, that's just, wow. I mean, it's so low. Yeah, I'm not going to say any more except wow. My question is around the take up of the tax-free childcare, because it says in here only 32% of the parent carer respondents reported that they were using the scheme. Now, when I've looked into it previously, I've actually stopped looking because it's seemed so complicated to me trying to work out who's entitled to what. Does this reflect, do people just give up? Sort of, do they not know about it, or have we somehow managed to make the process so complicated that they give up, sort of applying for it? And I see that we have an ambition to try and tackle that. So I guess my question is, how are we going to tackle that low take up locally? I see that there's going to be a national scheme, and we're going to then follow it up with the local one. And what are the levels that we'd like to get it to? 32% now. What's kind of our ambitions? Thank you.
Thanks, Councillor. Picking up on the first point, recruitment. So the service does offer support around recruitment and retention. We're not a provider, so it's not for us to do that work directly, but we do some work in schools trying to encourage that pathway and that interest in working in the sector. So that's part of the support that we give to the sector. The bit about the tax-free allowance component of it. In terms of what our target is, to be honest, I don't actually know, but 32% is really low, isn't it? What's frustrating about it from our perspective is you've got 85% of providers signing up to the scheme and such a low take up from families. So that's disappointing. There is a national scheme. We will ride on the back of that national scheme, and we will put leaflets into all the provision, and we will provide that information through the Family Information Service locally. So I think we will do what we can to drive up that interest. We want to encourage providers to actually hand out the leaflets to parents when parents are turning up to pick their children up, but we can only influence that, I guess.
Thank you. Councillor Garvin.
Thank you, Chair, and thank you for this report. I want to just do a little bit of future gazing, and as has already been said, any extra funding for childcare is welcome, particularly as we're a country which I think we have the most expensive childcare in Europe, if not in the developed world. And yet we're all supposed to go out to work. What concerned me about the announcement was not the additional funding, which, as I say, is welcome, but the announcement that there was going to be changing ratios in the number of adults to children, and how that is, and I know we're not a direct provider and we're not the regulator either. So in some ways we have a very arm's length role in this. But there has been a lot of noise in the childcare sector from the side saying that they will not change their adult to children ratio because they consider the current ratio to be a safe ratio and a fair, good ratio for childcare arrangements. However, will we be expected to assess sufficiency based on the new expected ratios or the actual ratios which that childcare providers are willing to work with? Because if it's the former, we're going to get a very false picture, I think, of the places that are available. And to go along with that is how will we work with those providers in terms of ensuring that if there is an increase in the children to adult ratio, that is done in a safe and secure way. Thank you.
Thank you, Councillor, for those questions. I think you've hit the nail on the head. I think you're absolutely right. Our understanding is the majority of providers do not regard the new ratios as either appropriate or safe and do not intend to apply those new ratios. So that potentially then opens up two areas of concern for those providers. One is how we measure sufficiency, which is the first one that you've highlighted. The other one is whether the funding ratio is reflected in the new ratios being identified by government. We don't know the answer to that, either of those yet, but they're big questions to be answered. Thank you.
Councillor Davis.
Thanks, Chair. Yeah, buried in some of these bullet points on page 43/27, depending on which number you look at, this is the parents' questionnaire. Was something supporting what we anecdotally as councillors and normal people hear quite a lot about, which is the limiting cost of the effective cost of childcare on limiting people's freedom to do more work, take more work, etc. So, for example, 60%, it says here, 60% of parents reported they didn't purchase additional hours because they were too expensive. Is there any idea of or notion of having a sort of affordability element to this report in the future, so that we were not just looking at sufficiency of childcare, but a kind of like cost per extra hour of childcare relative to the median income or something like that? So that could be a measure of how much it is worth taking on extra hours of work compared with how much it would cost in childcare to do that work, because that's something we hear about. We do hear quite a lot from people saying, well, there's not much point in me going back to work because all my extra salary will be taken up by childcare costs. So availability is one thing, but affordability in a ratio to sort of income that's available is a key thing, really, I feel, and I'm not sure this doesn't sort of come out in this report to me.
Thank you, Councillor. So yes, I guess is the answer. We could try and look at that difference between the cost of the free childcare and then the paid for cost of those additional hours is substantial, isn't it? And so providers will make more money out of the paid for provision than they will out of the free provision. But we could certainly try and include that information, that detail next time around. Off the top of my head, I don't know how we do it, but I'm sure we could. I'm sure there's a way of doing it. Sure.
Thank you. Any other questions? No? Thank you very much. Thank you for your report. Oh, that seems like it's the end of the business. Short meeting and end of all the work that we are doing. Sorry. Oh, sorry. So, yeah. on this last one. Yeah. Sorry. On this Reading Childcare Sufficient Assessment 2022 to 2023, agreed. Thank you. Sorry. Thank you. I'm excited about getting out. Yeah. Thank you. Thank you very much. So this is our last business of as committee for this until we meet on the other side, and those who have elections, good luck everybody, and thank you. Good night.